Hi everyone, I'm Chrissy Midwife and welcome back to my YouTube channel. Today's topic is all about Group B Streptococcus, also known as GBS. But before we get started, I'd love it if you could subscribe to my channel, hit that little bell beside it, and give this video a like and a share. In the last few weeks of your pregnancy, your midwife or obstetrician will do a test for the GBS bacteria. GBS is a bacteria that is usually found in the gastrointestinal tract, the vagina, and the urethra. It is a completely normal part of the flora of your vagina, and it gives you absolutely no symptoms whatsoever. And that's because it's just a normal part of your body. Now, when we think about bacteria, we think, ugh, that sounds terrible. And we sort of think about infections. But actually, bacteria are just a biological cell that help your body stay healthy. Women have a heap of bacteria in their vagina, and that's a good thing because we want our vaginas to be nice and healthy. A study has identified that about 24% of women in Australia, or 1 in 4 women globally, have the GBS bacteria in their bodies. Now you might be wondering, okay, well how do I tell if I have it? Around about 35 to 37 weeks of pregnancy, your midwife or obstetrician will do a GBS swab. Side note, some care providers will do this for you and other care providers are really happy for you to do it by yourself. So just have that in mind when you go to your appointments. Basically what happens is your care provider will use a cotton bud or a Q-tip and they will insert it gently inside of the vagina and then swipe down towards the rectum. It's really quick and painless. And then what happens is we pop this swab into a little pathology tube and we send it off to the lab to be tested. Basically, it's either going to come back and say you're GBS positive or GBS negative. Okay, so now we're on the why do we care about GBS? It really comes into play when we're talking about labour and birth. And this is because the bacterium can be transferred from mum to baby through labour and birth, and in some cases cause an infection in your baby. There's 2 kinds of infection. The first is early onset GBS, which happens in the first few weeks of your baby's life, or late onset GBS, which can happen up until about 3 months of age. This infection can occur in your baby because the GBS bacteria is a foreign flora for your baby. When you're birthing, your baby obviously comes down through the birth canal and out of the vagina. And that is where the GBS bacterium is going all over them. In some cases, this GBS bacterium that's transferred from mum to baby can make your baby very, very sick. Some symptoms that show your baby has in fact picked up the GBS infection are they experience some respiratory issues, general sepsis, which is an infection in the blood, which in turn affects the body, or meningitis, which is an infection in your baby's brain. Obviously, all of which we really don't want to happen to your baby. What happens if your swab comes back positive? Your midwife or obstetrician will discuss with you the benefits of having some IV antibiotics in labour to protect your baby. Ideally, we're going to give you a dose of a penicillin-based antibiotic when your waters break or when you start labouring. We continue to give you this antibiotic every 4-ish hours during labour. And the reason I say 4-ish hours is because it really does depend on what antibiotic the doctor prescribes. Ideally, as I said, 4 to 6 hours throughout labour and birth, we would give you a dose of this IV antibiotic. If you are GBS positive, your midwife or obstetrician will discuss with you the need for you to potentially come into the hospital a little bit earlier than you had originally expected when you're in labour. The reason is ideally we'd like to get 2 doses of the antibiotic into you before you birth. So when you come in labour, your midwife or obstetrician or nurse will ask to put a cannula either in your hand or in your arm and connect you to an IV line. The antibiotics are administered over about 30 minutes. So it is a really good idea to be mindful that while you're connected to the IV line, you are a little bit restricted in your movements. But once the dose of antibiotics has been completed, you can ask your nurse, your midwife, your obstetrician to be disconnected from the IV line so that you're able to freely move around the room and actively labour and birth. Just be mindful that the cannula, either in your hand or your arm, will stay in the entire time that you are in labour. The other thing to remember is just because you're GBS positive doesn't actually mean that your baby will get sick. If you have the antibiotics, research indicates one baby in every 4,000 will actually pick up the infection. If you are not able to have the antibiotics, let's say you birth really quickly or potentially don't make it to the hospital in time or decide to decline the antibiotics, which you are well within your rights to do, the risk of transmission is 1 in every 200 babies. So it's something to definitely have a discussion with your care provider about. Some other reasons why your provider might treat you as GBS positive are if your waters have broken before 37 weeks of pregnancy, if at any stage in your pregnancy you've done a urine sample that has picked up a GBS flora in the urine, we would then still treat you as GBS positive. If your waters have broken over 18 hours and you still haven't birthed, if you've had a baby previously and they have in fact had the GBS infection. These are some of the reasons why we would actually treat you as GBS positive regardless of what the swab results are. As a midwife, I get asked by pregnant mums throughout their pregnancy, can they in fact take some antibiotics so that they reduce the risk of a GBS bacterium in their vagina? And the short answer is simply no. The reason being is because your baby is in those beautiful membranes protected by the amniotic fluid, they are in fact at absolutely no risk. This is also important to note for our caesarean birthing mums. There is absolutely no reason for you to have antibiotics either, because until your caesarean section, your babies are also protected in those membranes as well. Now that we know what GBS is, the important question is, well, how do we know if your baby has in fact picked up the infection? And quite simply, and this depends on what facility you're birthing at, for about 24 to 48 hours post-birth, your baby will have some regular checks done. So every sort of 4 to 6 hours, we're going to check their breathing rate, their heart rate, and their temperature. Those things are going to tell us the health of your baby and if they have in fact picked up that early onset GBS infection. It's important to note that we won't treat your baby with any antibiotics unless they themselves become unwell. So to recap, GBS is a normal flora in the female body, usually found in the gastrointestinal tract, the vagina, and the urethra. Okay? Normal flora keeps our vaginas nice and healthy. Why do we care? Well, we care because if we're going to labour and birth, we need to make sure that that GBS bacterium doesn't potentially infect our babies and make them really, really sick. Ideally, we would like you to get to hospital at least 4 hours before you birth so we can get a dose of a penicillin-based antibiotic into you through an IV to decrease the risk of your baby having the GBS infection. Little reminder, as I said, if you're able to get the dose of antibiotics, the risk of your baby picking up the GBS infection is only 1 in 4,000 babies, which is pretty good. And only 1 in 4 women will actually have the GBS bacterium in their body. If there's any questions you'd like answered about GBS or GBS infecting your baby, pop them in the comment section below. If there's any videos on pregnancy, labour and the postpartum period that you'd love me to do, also chuck them in the comments as well, or follow me on my Instagram or Facebook page.